Hello everyone, welcome to Wellness HQ podcast. And on today's episode, we are going to talk about ExpressMed Ghana. I'm sure you might have heard ExpressMed Healthcare. So today we have the founder here, and it's in the person of Mr. Patrick Anan Nunu. Senior,
thank you.
How are you doing?
I'm doing well. How about you?
I'm fine. By God's grace, as you can see.
Yeah.
I'm happy to see you actually because it's been a while.
Thank you.
So ExpressMed, what is ExpressMed Healthcare? What do you guys do?
Well, ExpressMed Healthcare is a health tech company that is making healthcare more accessible for every family in Ghana. We believe that everyone deserves quality healthcare regardless of wherever you are in the country, whether you are in the urban or rural area. And so because of that, ExpressMed took it upon itself to open it up for everybody, to make it accessible. And so you find that we provide home care services sometimes. I'm sure we'll go into it as we go along, where we have doctors visiting people in their homes to give them quality health care. We also have nurses who stay with vulnerable patients, the stroke patient, dementia, blind, those who are immobile. We have nurses living with them as well. But recently we've added corporate wellness to cater for the busy, workers. We take healthcare to their companies and do things like medical screening, health talks, on-site aerobics. But our newest baby is the Telemedicine app.
Yes.
We've developed an app to make it even more accessible for everybody, regardless of wherever you are.
Yes.
So,
Before you came, I made quite few researches, and I realized that there's a new initiative called the Telemedicine app.
Yeah.
So I wanted to ask what inspired the telemedicine app.
Well, that's a good question.
Yeah.
What inspired our telemedicine app? I would say that, at the heart of what ExpressMed does is technology.
Yeah.
The whole healthcare services at our office revolves around tech. How can we leverage on technology to give everybody opportunity and to give everybody a chance to make quality health choices? And we realize that telemedicine is the way to go. We need a platform that everyone can access, and so a platform that can host a lot of doctors, all the good doctors you can think of, both general and specialists, and then a platform that patients can also log on into and then have options, so that they can even be spot for choice, so that they can talk to any of these doctors at any time.
Right. As Ghanaians, we are still getting used to the internet and all. Recently, my mom, I see my mom on TikTok and all, so we are still getting used to it. So, what are some of the features on the app, on the ExpressMed Ghana app that you could see, and how does it work?
Okay, so just to take you back a bit,
right?
Internet penetration in Ghana is at an increasing rate, which is good.
Yes.
But in terms of telemedicine itself, I think that the perception in Ghana is hospital.
Yes.
Hospital. When I'm not well, the first thing that comes to mind is hospital. The second is pharmacy.
Yes.
So
actually, the first is pharmacy.
And then
very serious hospital.
Yeah. Good. So the concept of using, seeing the same doctor on just your phone is perhaps now growing.
Yes.
And that is what we need to look at. And so let's come back to your question. You asked about the features on the telemedicine app. So if you, I'm sure we'll get to where you can download the app. Yeah. But if you have the app with you on your phone right now, you have access to doctor consultations. So you can talk to a general doctor or a specialist doctor. We have a lot of specialists on the app as well. We have pediatricians, doctors who look at kids. We have dermatologists, those who look at skin, neurologists, ENT, ear, nose, and throat specialists, and it's growing. We have gynecologists on the app. We have optometrists ears on the app as well, and it keeps growing because doctors have come to appreciate the essence of being in touch with your patients. And so there is a general and specialist consultation where you can talk to a doctor through video. You asked about features. So there is a video call functionality.
Right.
So you can see the doctor in the consulting room, which gives it that feel as if you are sitting in the office physically. There is also audio in case you are in a place that you can't really show your face, you want to do audio. And then there is text as well. But we've also added health resources and education.
Right.
So you don't always have to fall sick to see a doctor. And so at ExpressMed, we really hammer on preventive medicine. Like prevention is very important. And so sometimes we focus on the 3 tiers of prevention: health education and awareness, early detection through medical screening, and then treatment and management of diseases.
Right. So moving away from the features, what measures have you taken to make the app accessible to Ghanaians and the world at large?
Well, still on accessibility, we take advantage of social media a lot.
Right.
And so you find us on all the social media platforms: ExpressMed Healthcare or ExpressMed GH.
Right.
Instagram, X, anywhere, you name it. And so we are heavy on social media. And also to bring the concept home and make it resonate more with Ghanaians, we create content. And so you find us doing a lot of...
I saw some of your content.
Yeah. We try. It's not easy shooting health content to make it funny and interesting, but we still try to get the message.
It's a work.
Yeah, and in the content, we try to chip in the app as well. We also do a lot of screening, medical outreach, even to rural areas. And so during these screening programs, we educate people and we tell them about the app, and then they get to access it.
Right. So what are the challenges you've encountered launching the app and making it accessible to Ghanaians? I know with everything you do, there are challenges.
Okay.
So I wanted to find out the challenges you've had so far.
If I start a list of challenges, we won't finish now, but I can list a few.
Yeah.
As a health startup in Ghana, some challenges are very common in the industry. One of them is building a very robust technological infrastructure. And so we really need to invest in the tech components of the business.
Right.
For instance, currently we've been able to develop the Android version. So we have it on Google Play Store. And this was built out of packet.
Yeah.
We are just about finishing the iOS version, so that Apple users can also have access to it. And so one of the challenges, of course, is the tech infrastructure. Another you can think of is finance, money.
Yes.
You need to fund this project and make it, make people more aware. We need to do more ads, partner, do a lot of collaborations, and make people aware of the benefits that they can get from the telemedicine app.
Right.
And obviously, sometimes getting developers who are really on the project to stay with us can also be a challenge if you do not have the right finance.
The investors out there, please, I think this is a good initiative. So I'll take this opportunity to plead and tell you people that you should invest in ExpressMed Healthcare, because it's a very good initiative. Having access to subscribing to the Honest HQ channel, download the ExpressMed Ghana app on Play Store. It's not on Apple yet, but I believe Mr. Patrick here will do the magic and everything will be fine. So back to what we're talking about. So what has been the reception from Ghanaians, and how has the ExpressMed Healthcare impacted on their lives?
It's been amazing.
Right.
It started slowly, somewhere middle of the year, but now from our analytics, we record new downloads every day.
Right.
Over 10 downloads, we are exceeding 100, sometimes 1,000.
Oh, then it's growing.
It's growing, especially among the young people, obviously.
Sure.
Between 18 to 26.
Right.
We have a lot of users in that category. So I think that in terms of reception, we are getting but obviously more needs to be done. Another interesting area we found is young corporate workers. So we've had organizations call us for medical programs, but then when we go, they try to tailor the app to their staff, and so their staff get to access the ExpressMed app instead of always asking for permission to go to the hospital and then come back, which sometimes takes so many productive hours. And so it is something that is also resonating, not just with the youth, but it's also among workers.
So let's talk about security. What measures have you taken to ensure the privacy and then data security because now then again technology is moving at a fast rate, so then anyone can just hack into systems and take information you need. And since your app is a technology based app, I mean, what are the measures you've taken to ensure the privacy and data security?
Okay. I mean, this question came up when we were doing the prototype. That one of the key questions that came on was how to make it secured for patients, because it's health information.
Right.
And in this day and age, some tech developers are selling data and all that. So we have a strong confidentiality clause with our patients, where we do not release their information to third parties. We also have even though without a lot of funds, we've been able to build a strong data center and a strong infrastructure that is secured for patients. We also do not share, there's a lot of authentication and login procedures.
So it's highly confidential.
Yes, and highly safe. We've tested it and it is strong and safe. Another thing we can also say is that even among patients, we do not share your information with another person, maybe a family member. We need your consent before we can release, unless you are a minor and maybe your parent is accessing it for you. And even among the doctors, they go through a rigid procedure to assess another patient's information to continue consultation. So it is very robust, very safe, and very strong.
Right. Also soon, we are coming to the end of the interview, and I wanted to know the future plans for ExpressMed Healthcare.
I mean, we have a lot of exciting projects coming up, a lot of features on the app. Our goal is to even consider persons with disability. We want to factor in a lot of accessibility features. So some readables, large text, voice commands, so that they can listen, for any form of disability. Because I think sometimes they are marginalized, but they are an equal part of the society, equally
very important to society.
Yes. So our next feature is to make it equally accessible for persons with disability as well. And we also want to invest more in rural areas. We have a new feature coming up called the Agri Health Tech. This is tailored towards farmers. And so we are also interested in the well-being of farmers, not just the farm produce. I mean, you want to eat healthy food, but the farmer also needs to be healthy. And these are people that we mostly ignore. So we are tailoring our services towards them as well. And in the long run, after a successful story in Ghana, we want to take the success story to other African countries. So maybe Nigeria can expect ExpressMed Nigeria, ExpressMed SA, and you can have that. So you should just watch out, just download the app and then turn on your notification, and you'll be the first to know if any new feature, exciting product comes up.
All right. Thank you so much for coming.
It's good to be here. Thanks for having me.
And I hope this ExpressMed Healthcare goes far, because the vision you have is very good, and I think it will help everyone in terms of their health. Keep subscribing to the Wellness HQ channel. Thank you so much for watching, and make sure you download the ExpressMed Ghana app on Google Play Store. See you in the next episode. Bye.